Right. So this next section here ties really nicely in between both professions, where the clinical pattern recognition app. So what you see on the left-hand corner of this screen is all the apps that PhysioU has built, and there's more coming. So you can see assistive devices, clinical pattern recognition, cardiopulmonary rehab, some of which is more useful to different professions and some of which are useful equally. So like the neuro exam app covers all of the neurologic tests that any professor in OT or PT, go ahead and click that. You could see we've broken it up into motor control, sensation, coordination and balance, the Fugelmeyer, the Asia scale, all of that is already filmed, accessible to the instructor. So, I mean, this is a very powerful resource that just used to not exist, period. We just had a large binder full of all of the different neuro tests. So you can see the splinting app down there, special test, range of motion MMT. And I know David's going to get into the splinting app in a second, but if you think about the clinical pattern recognition app, so the orthopedic rehab app, and you looked at, for example, wrist and hand, I'm going to let David talk you through it, but you can see that we're trying to create common patterns. So we are trying to create patterns of patients. So David, if you click on all diagnosis for me, you'll see that many of the common conditions for the wrist and hand are there. And so it helps to give context as we talk about examination and treatment and therapeutic exercises and modalities to be able to actually go deeper into a condition. So go ahead, David. I'm going to let you...
Yeah. So we'll go with carpal tunnel, obviously, because it's probably one of the most common things in the hand, that and wrist fractures. But so what I love about it, and again, what I teach is it's a combination. It's basically a hand therapy course. So we teach just called orthotics and positioning, but essentially what it is it goes through hand therapy, splinting, upper extremity rehab. We also cover prosthetics and orthotics as well. But so when we go over carpal tunnel syndrome, and I like to give examples, some visuals. I have the students actually develop their own video based on a case study. So for this actual assignment, they get a diagnosis, and one of the partners acts like the patient, and the other partner acts as the clinician. And so they actually have to go through an evaluation and a treatment on the video and base it on what a clinician would actually kind of think about. And so I often get questions from students, well, how am I supposed to figure out what a clinician would think when we cover the basics in lecture and we go into as much depth as we can? But what I love about this app is they can actually go into this app and think like a clinician would, right? So if we look at carpal tunnel syndrome, we have prevalence. So they can go through and look through the prevalence of 1 to 5% of the general population. So they're actually starting to conceptualize it. They can see that 5 to 21% in manufacturing and meat packing. So they can start to think, well, manufacturing and meat packing has a repetitive nature, right? So then we can think that maybe somebody who has a repetitive job might be more prone to getting these things. I know that sounds somewhat remedial, but at the same time, as a student, they're trying to bring in so much knowledge at once. It sometimes is very difficult for them to really critically think when they're trying to go through so much different content in multiple different areas. You can see the prevalence, incidence, and then we'll go back.
Just as a side note, you see all that Chinese down there. We've been busy translating all of the apps into multiple languages. That will soon be cleaned up. But this is how we are trying to impact on a larger scale all these apps to try to unify the professions on a world level.
Yeah, exactly. And then you can also look at your physical examination here. So you can see key findings. And it actually has videos of patient complaints, risk factors, I love the median nerve assessment and where the different entrapment points are. You can see it here. And this is very nice to kind of start to conceptualize things as a student of, okay, well, the median nerve obviously runs down from our cervical spine and comes down into the hand. But here are some common locations in the upper extremity that they can get entrapped in. So it might not just be carpal tunnel. We might have pronator syndrome on top of it, right?
And just to be clear, all of these are not only videos. So, David, if you click back, let's say to Phalen's test, let's go to Phalen's test. They're videos with, if you scroll down into the text, the validity, sensitivity, reliability, specificity, and sensitivity, all the instructions, as well as the citations. So at the very bottom, you'll see that the citations are there, and they are all linked to the PubMed abstracts. So if you click on them, typically they will take you directly to a PubMed abstract. So, and then you'll have to just click back. Yeah. So, I mean, a lot of work has been gone into trying to make this a useful tool for integrating research. And even from an accreditation standpoint, it's nice to be able to say the resources that our students are using are constantly being updated. So. Yeah, so I was actually going to cover Phalen's test right after. Yeah, nice.
So when we go into Phalen's test, then you can start looking at provocative tests, right? So if we're thinking about evaluation and just kind of conceptualizing signs and symptoms and what entrapment points are, now we can start to look at actual diagnostic testing and looking into the reliability and sensitivity of these things. What we're using sometimes, as we know as clinicians, sometimes our provocative tests are actually just as reliable as some imaging at certain times. So it's excellent to kind of see some of that. And as you can see, we're working on translating it into multiple different languages and bringing that across the entire world. So if we go back then, the carpal tunnel. So now we think about evaluation, but then obviously we have to think about intervention. So the nice thing about here is we also have some widely used interventions for the diagnosis. I look at manual therapy because I'm very much a hands-on practitioner and a learner as well. So we can look at entrapment reduction and how soft tissue mobilization. And it's a way. It's not going to. It's an excellent way for students to kind of get that visual of what it actually you are supposed to be doing. If you think about a lecture in a textbook, you're going to get what's great for carpal tunnel. Well, tendon glides, median nerve glides, soft tissue mobilization, and modalities. But that's all it says. It doesn't tell you specifics. It's not going to show you how to do soft tissue mobilization. But we have the video here that can actually show how to do these techniques, not just tell you, well, do soft tissue mobilization at the carpal tunnel. I would say that's a very, very common question I get from my students is, well, how do you actually learn how to do these techniques? Well, here's an excellent way to do that. And once you get your hands on a patient or a partner, you're going to be able to master those techniques based off of the videos. So that would be I think in a nutshell, the clinical pattern recognition. I want to leave some time, so I'm going to switch over to the splinting app then.